Cool, thank you, and thanks for sticking around today. I did not write out my presentation. I heard that that's using slides is a faux pas and historical world.
Our slides, maybe.
Oh, okay. I thought slides are a crutch, maybe. It also happens to be Canadian, so I think 50% of the afternoon is Canadian today, so that's also a good point. Okay, so I'm going to talk to you about how we're trying to rethink influenza surveillance and just general public health surveillance, and talk about the kind of data that we're generating both through data mining and crowdsourcing. Usually traditional public health, and I don't know how many public health people are in the room right now, has data that flows in one direction and in a slow way through the public, to public health practitioners, to officials, to ministries of health, to our bodies. And that flow of information, and not all data obviously flows, can be time consuming. And from the point of real-time surveillance, that is an issue. And so a lot of our work has focused in this area where we've turned digital disease detection, with a lot of different names for it, but the idea that we're harnessing data that exists outside of traditional spheres of public health that enables us to do things in research that would not be possible and sort of gets outside of the traditional flows of information. So the kind of information that we're talking about is data that exists on the web. So it's social media data, it's news information, it's the kind of stuff we're talking about today. It's all the data that flows up in the process of an epidemic. So it can be searching on a search engine, it can be health expert reporting online. So there's a variety of different data streams that we think about and that we tap into to provide a sort of a broad view of what's happening in the population around emerging disease. So we also know that this kind of data is not, although it's not the most sort of traditional, it's also what sort of aids WHO and other organizations to improve their surveillance of emerging infectious disease. The availability of these sources are contributing to our ability to know about emerging diseases from mid-90s in the order of months to now more in the order of weeks and even days. And that's essentially the basis for why we created a system called HealthMap, which is a global emerging disease surveillance system that was created about 7 years ago with support from Google and a variety of other sources. The idea of providing sort of a more sort of complete picture on public health issues, sort of almost like your weather.com for disease. I'll just explain sort of how the data mining process works because it could be very parallel to some of the data mining aspects from the historical perspective. So we're constantly mining from as many sources that we can get access to, either from news aggregators to individual sites, social media sources, and we're doing this in many different languages. We do work in 15 different languages, 24/7, resulting in about a couple thousand new outbreaks that we identify every single day. So we're talking about sort of just large data sets. We just hit our 2 million disease outbreak in the past 7 years. So a lot of data that we're dealing with in terms of public health issues. And so from our perspective, we're doing natural language processing to basically turn free text descriptions of public health events to a database that we can then analyze, whether it's case counts, disease name, locations, geographic representations, and of course, the deeper we get into geography, the tougher it is to automate those processes. But the idea is that we're taking all this communication, this flow of communication, and turning it into a structured database that we can then represent and do research on. And then, of course, you can imagine huge amount of noise in this kind of data, so we're constantly filtering that data, taking information that is describing disease outbreaks or warnings, and removing, well, I guess maybe people in this room, they would want the historical data. We remove the historical data, though we saved it, so if anybody wants it, they're welcome to it. But the idea is that we're organizing text, clustering information on the same topic, so we're not having to read the exact same article over and over again, and then rating information based on the disease, the location, the case counts, and then mapping that information. And that's a process that iterates every single hour, 24/7, for the last 7 years. And so it's built up a substantial data set that anybody in this room, of course, is welcome to utilize, and there's a few people I know that do already. So just a couple examples related to flu. So the earliest signs of some of the H1N1 events of the pandemic, people remember that from 2009, did not come out of official sources. They came out of news media. So this is a newspaper describing an unusual illness that took place in Veracruz, Mexico. That was the first public instance describing this event well before any official acknowledgement. And then from there, while it's hard to identify this needle in the haystack, we can then begin to provide a global picture of an emerging pandemic in a way that's completely different than what's been able to achieve in the past. So much so that we can actually do prospective surveillance on H1N1 from country to country in all the languages that we're monitoring to provide this picture of the disease in real time. So that was definitely a big change for this sort of idea of data mining public data, where we could get that sort of comprehensive view given the amount of data that's online. Fast forward to this year, and it's a completely different picture. This is a paper that we wrote on H7N9 in the Journal of Medicine, where essentially we were taking a look at data from social media, specifically. Social media, including Twitter, and a Chinese network called Weibo, and monitoring that heavily. Although we did get kicked off of Weibo a couple times, we kept pushing ourselves back in, so that was good. So we were able to log a huge amount of flu-related data. This picture, especially, here, is a picture of someone who took a snapshot of an electronic medical record and posted it to the social network about a case that occurred in the province of China. So we're definitely drinking out of a fire hose of data. As far as information that's coming out of China, which 10 years ago with SARS, we had trickles of information. So it's a completely different scenario. I also just want to talk about this, the whole idea of data mining for the 1918 pandemic with our technology is something that I actually tried to do maybe about 5 years ago. Then it stopped, not sure why, but the point is that we mine Google News archives, and you're right that a lot of that data is missing now. And we were able to show just that you could sort of mimic the influenza epidemics based on mentions of flu in different news articles historically. So there's some very interesting patterns that emerge if you compare Google News, for instance, to mortality data. And I'm sure that's this animation, but this is just a more zoomed in view of the 1918 pandemic. And then we can do some interesting things like separate out the data by geography and look at the emergence of the pandemic strain across different cities. And so we started that process of actually trying to tease apart those different patterns that emerged by geography. That's where we stopped, but so it's very exciting to see this kind of work that's happening at a much more sort of complex level than what we did initially. Of course, news is only part of it. There's a lot of people that have come into this game of flu surveillance, and I assume that Gunther might touch on this because, in fact, Gunther is actually credited with having come up with the idea of using search query data for flu surveillance. Google eventually took that concept and built a whole system around it, for better or for worse, and I'll mention exactly why it's not an ideal practice, but there's mass amounts of data that you can harness on basically what people search for online as a sentinel for flu. We've done the same thing in a different number of different domains. Here's an example of doing flu surveillance in China using the search engine Baidu that we recently published. And this is actually from work that some of our collaborators have done, and I know Gunther and many other people have been using Twitter as a tool to monitor influenza as well. So many different examples. I could spend 2 hours talking about the different examples that people have done on this in this space, but I will stop now. But I will mention that some of these systems are not actually ideal because if left sort of unattended, they basically can have real problems. So if you're not sort of considering the context of the data, people's behaviors change very quickly, and the ways in which people use the internet changes, and so you can't just sort of let these systems sort of run wild. Last flu season, Google Flu Trends overestimated influenza based on the fact that people were very worried about flu, and so some of their terms that they used basically didn't come across in the right way, so essentially they've had to redo their models. But so that really sort of begs the importance of the human element for some of these automated systems. There's another system where there's a line in there. This is from a Nature article called Flu Near You, which is another system that we've developed. So I'll just mention that real quickly. It's an area that we think is very important, an area that is actually potentially much more fruitful than data mining if it can be done properly, which is crowdsourcing and getting people to actually contribute data for a specific purpose rather than mining information and hoping that the intention of that information that you're collecting is along the lines of what you were expecting. So I'll just mention Flu Near You because although it's not going to serve anybody boosting, but historical aspects. Now, maybe in another 100 years, this data will be helpful to recreate a picture of influenza season. So essentially, this is providing a website where people can understand influenza using various data streams, including CDC. But importantly, it's asking people to engage in a system through either mobile or through Facebook or online. And simply, we're asking people just to tell us how they're feeling on a weekly basis and tell us if they've been vaccinated, tell us about their household. It only takes a few seconds each week, but essentially using this kind of approach, we can actually crowdsource flu through the community at a very high resolution, a much faster pace than any other data stream, as long as there's enough people in the system. And that's actually the trick to some of these efforts is, you need the right sample size. So the reason to do this, of course, is we can identify the problem. We can actually use this as a source of information, especially, although we're not in a shutdown anymore. I've had 2 weeks of being able to talk about how we had a flu system that was running where the government didn't. I guess today I can't use that line. Intervening is another area. We run a system called the Health Map Vaccine Finder, where we're organizing all the vaccine locations across the country, providing people with where there's available vaccine, how much they pay for it, and how to get to those places. So that, again, is a tool. And then finally, evaluating. We can quickly run very, very fast evaluations on the impact of being vaccinated versus unvaccinated influenza. So there's all sorts of opportunities with this data. The challenge, as I said, is getting people engaged into a system like this. We do a lot of publicity, billboards. That doesn't really work that well so far. These kind of things work when you have a big scare factor around flu season. Then we can get people in the system, and we have tens of thousands of people in the system that are telling us how they're feeling on a weekly basis, and we've expanded this to a variety of different locations, Canada, Puerto Rico, and into South America. So this is an area where we think there's huge potential if we can figure out the incentive structure properly. Just want to mention a couple other examples of things that we're doing that can go beyond data mining. So we are working on a project right now where we're in fact handing participants, a tool called ScannaFlu, which is a company out in San Francisco. There's many efforts that are where they're at-home diagnostics, where companies are trying to think through the quick way for people to self-diagnose themselves and do actually viral confirmation at home. So what we're doing is we're sending people these kits where they can actually identify the viruses that they had and actually report that back. So we're going beyond just symptom tracking to actual viral confirmation. And this stuff is going to become more and more commoditized to the point that we really don't need any self-reporting. We just have people report to us automatically the virus that they had, and then we do it, and we'll have the data for the population. The other aspect to that is passive data collection. We're actually building a smartphone thermometer that will be launched probably in the next 6 months, hopefully, where people will use actually the thermometer connected to their phone, find out about all the people around them that are sick, but that information also uploads to a global system where then we have temperatures on all sorts of people. And hopefully the benefit to individuals, they can also get recommendations and guidance and understand what else is happening, because we have all the data on illness across the world, but they'll then once again be part of the system. So that's another area that we're focusing on now, which is going beyond just asking people to do anything at all. So this is a paper that we just wrote recently in PLOS Medicine, where I think the point is that these types of data are only one piece of the equation. We're doing a huge amount of work trying to integrate our data with climate information, with landscape. So there's also, the kind of data that we collect is only one angle. And when it comes to flu surveillance, it's obviously a mosaic of different sources that you would want to tap into. And of course, the really holy grail here is not just doing nowcasting, which was a lot of what I just showed you. It's actually trying to come up with an early indicator of how bad things are going to be, when things are going to start. And we've been working on modeling aspects of taking that data and projecting upward and forward in time, which is a huge amount of work that we're doing with Loren, who will be speaking shortly, and he'll go more into this. So, big data. There was a huge amount of hype, and I actually hate saying the word big data, or the two words big data, I guess. There's been a huge amount of interest in the idea of tracking, and I think that we have to really, hey, how's it going? So the idea, it's very easy press angle for people to latch onto. but at the same time, a huge amount more research needs to go into actually understanding the value of these data, and it is not the holy grail that I think people think it is. And then at the same time, there's been a huge amount of backlash, as you can imagine, on the lack of context. This is my favorite bad science on steroids. We got mentioned that one, so that was nice. So there's also obviously a lot of concern with Google's issues, obviously put into question the reliability of these data. And of course, you can imagine the privacy issues that NSA has brought up also around these data put this whole area into question. So just worth discussion around some of these topics. I'll leave it there, and then there's some questions. Thank you very much.